Welcome to the Magnificent Minds podcast. I'm Dr. Suzanne Goh, a neuroscientist, pediatric neurologist, and board-certified behavior analyst. This podcast is for parents, family members, and professionals who want to better understand autism and get access to the most effective, research-backed, innovative therapies. I'm really glad you're here. Autism is surrounded by more controversies, misconceptions, fears, and straight-up myths than almost any other diagnosis. And I've spent 25 years of my career sorting through all the noise to get to the truth, so I can share the most effective therapies with you here. When your child was just diagnosed with autism, someone probably handed you a stack of pamphlets and told you to call some ABA agencies. Maybe they said something like, early intervention is important, and sent you on your way. And you faced so many unanswered questions. What kind of therapy? How many hours? What about diet? Supplements, medications? Should you be worried about their gut health, their sleep? What could you expect? What would the future be like? The internet says 1,000 different things, and half of them contradict each other. I know that feeling, and I'm here to tell you something that might surprise you. Most of what you've been told about autism is incomplete. Not wrong, just incomplete. I've spent 25 years studying autism from every angle. The brain, behavior, metabolism, genetics, and working with thousands of families. And what I've learned is this. The standard approach to autism is missing half the picture. Right now, if you take your child to a typical autism center, here's what happens. They'll evaluate your child's behavior, they'll recommend therapy, usually ABA, and that's important. Behavior therapy works. It helps so many children learn new skills, communicate better. But here's what ABA can't do. It can't look at what's happening inside your child's brain. They can't run an EEG to see if there are unusual electrical patterns that could be improved. They don't do metabolic testing to see if your child has, for example, a folate deficiency that could literally be starving their brain of what it needs to develop. They don't do genetic testing that could reveal a treatable condition. They don't treat the gut issues that affect behavior. They don't understand the neurotransmitters affecting your child's sleep, mood, attention. And even if you've found a way to get your child some of this medical care somewhere else, the fact that your ABA program isn't working closely with those doctors means your child isn't getting the best they could get. And this is the part that really breaks my heart. I've seen children who spent years in therapy, making slow progress, when a simple metabolic panel would have shown us they needed a specific supplement or dietary change or medication. I've seen kids who could have benefited from a medication that calms overactive brain activity, something we only knew to try because we actually looked at the brain with an EEG. Here's the truth. Autism is not just a behavioral condition. It's a neurological difference. And if you're only treating the behavior without understanding the biology, you're leaving so much potential on the table. And that's why I founded Cortica. At Cortica, we do something radically different. We start with the brain. Every child gets a comprehensive evaluation, not just behavioral assessments, but an EEG to look at the brain activity, genetic testing to identify any underlying conditions, metabolic testing to check for mitochondrial dysfunction and nutritional deficiencies, a detailed medical history to understand their whole health picture. And then, and this is crucial, we bring all of that information together. Our team includes neurologists, behavior analysts, developmental therapists, pediatricians, nutritionists, and mental health specialists, and we all work together to create a truly personalized plan for your child. Because here's what we've learned. When you combine behavior therapy with medical treatment, when you're supporting the brain while you're teaching new skills, kids make progress faster. Let me give you an example. I worked with a boy, let's call him James, who had been in ABA therapy for 2 years. He was learning, but slowly. And his parents were exhausted. They were doing everything right, but something wasn't clicking. When James came to Cortica, we ran our full evaluation. The EEG showed unusual activity in his frontal lobe, the part of the brain responsible for focus and executive function. His metabolic panel showed a folate metabolism issue, which meant his brain wasn't getting the nutrients it needed. We started him on a supplement to address the folate issue and adjusted his therapy plan based on what we learned about his brain. And within 3 months, he was a different child, more engaged, learning faster, happier. His parents were blown away by how much he was speaking and engaging with them. That's not a miracle. That's what happens when you treat the whole child. Now, I want to be very clear about something. As a board-certified behavior analyst myself, I know just how powerful behavior therapy is when it's done right. But it has to be done right, and it has to be paired with medical care. If an ABA agency is delivering 40 hours a week to every child in their care, walk away. That's a business decision, not a medical one. Your child is unique, their brain is unique, their needs are unique, and your treatment plan should reflect that. At Cortica, we ask, what does this child need? Not what does our business model require? What does this specific child, with their specific brain, biology, their specific family situation, what do they need to thrive? Sometimes that's 10 hours of therapy a week. Sometimes it's 25. Sometimes it's medication. Sometimes it's a supplement. Sometimes it's helping the parents manage their own stress, because we know that when parents are regulated, children do better. We look at everything, because that's what your child deserves. I also want to tell you something that might give you hope. I've worked with thousands of families over the last 25 years, and I've learned this. The future is never as scary as parents imagine it will be in those early days after diagnosis. I've seen children who weren't speaking at 3 who are now in college. I've seen children who had meltdowns every day who now have friends and hobbies and joy. I've seen so much unexpected beauty and accomplishment. But here's what made the difference. Early, comprehensive, individualized care. Not one size fits all, not just behavior or just biology. Both, together. And that's what this podcast is about. I'm going to share everything I've learned from the latest research on treatments like leucovorin and other metabolic therapies, to how to know if a therapy is actually working, to the real story on controversial topics like vaccines and Tylenol. There's so much noise out there, so many people with opinions, but not necessarily expertise. My goal is to cut through all of that and give you the truth, the research-backed, clinically proven, neuroscience-informed truth about what actually helps children with autism. Because I truly believe that knowledge in your hands can do amazing things. Before I became a doctor, I was a volunteer at a camp for children with disabilities. I was the swim instructor, and I'd watch these kids light up in the water, doing something they loved, something that challenged them, something that made them feel capable and strong, something that met their sensory and motor needs. That feeling of using what I'm good at to help a child discover what they're good at, that's why I do this work. That's why I spent years in medical school and research labs and clinics. And that's why I founded Cortica. That's why I'm here talking to you right now. Every child has gifts. Every child has potential. Our job is not to fix them or make them neurotypical. Our job is to create the conditions where their unique brain can thrive. And that's what we do at Cortica. That's what I want to teach you on this podcast. And that's what I hope you'll let me and our team at Cortica do for you and your child. In the next episode, I'll be answering the 3 questions parents have been asking me the most about lately. What's the real relationship between Tylenol and autism? Should my child take leucovorin? And what about vaccines? Is there actually any risk? And should you space them out? Thank you for listening. If you want to learn more about Cortica and find a center near you, visit our website. If you want to go deeper into the science and strategies I'm sharing here, check out my book, Magnificent Minds. And please, if this resonated with you, share it. Share it with another parent who's struggling. Share it with a professional who wants to do better. Share it with anyone who loves a child with autism. Because the more people who know there's a better way, the more children we can help. I'm Dr. Suzanne Goh. Welcome to my new podcast, Magnificent Minds, Demystifying Autism. I'm so glad you're here.